my name is Angelina McCahon, and I studied abroad to Italy, Naples, Italy, with IVHQ over the summer. I volunteered at a free clinic for the homeless, which is great because I'm a nursing major, so I was able to help out with each different specialty of doctors, cardiologists, dentists, dermatologists, and orthopedic specialists. I met a lot of great people and learned a lot about the culture, and it was an experience that I'll never forget. So begin just looking at healthcare. There's a big difference between healthcare in Italy and the United States, or even just Europe versus the United States. Looking at Italy, healthcare is a right. It's the National Healthcare Plan, so it's called the Servizio Sanitario Nazionale, or SSN. Private healthcare is accessible to people as well, but it comes at a more expensive cost, so the public healthcare that's offered is much more advantageous, especially due to the higher level of poverty, especially in Naples, Italy. The healthcare quality does vary by region, so whether you're in the north, south, southern parts of Italy are known to be higher in poverty, so it kind of will just vary from there. But healthcare is easily accessible and affordable, unlike the United States. And then moving into the United States, as we know, healthcare is not guaranteed. It's not universal healthcare. It's limited and expensive, and insurance companies kind of are the determining factor in who is awarded care. And we did previously have the Affordable Care Act, which made healthcare more available to the public, and the hope was that everybody will have healthcare, but currently that's being repealed, so we'll have to see where it goes. Taking a closer look at Italy again, the SSN public healthcare does provide consults with physicians, hospital visits, lab work, and medications, but it's managed differently amongst each region, so you have to be cognizant of which region you're in. And similar to the United States, there are pharmacies all over to get your medication, and they're called farmacias. I immediately noticed that there was a difference in the size of hospitals. The United States hospitals are huge. They are all different types of hospitals. Whether you're a large chain like Kaiser or Sharp or other larger hospitals, basically huge chains of hospitals in many locations. In Italy, it's not really the case. It's more family-run clinics, hospitals, which is good because they are more personal, but the level of standardized care may suffer. There are disadvantages and advantages to both that I saw. And now moving on to the social climate in Italy, it really varied. The north was much more wealthy, and like I said, the further south, the lower socioeconomic status that was able to be seen. Italians living in absolute poverty right now is 4.8 million, and that's from 2016, which is a really large number. You will see homeless on the streets. It's very prevalent, and Naples is kind of a big area for that, so I was able to see that every day just even walking to the clinic. And right now a big problem is the refugees that are coming from Syria and Libya, Africa. Italy is receiving thousands of Libyan refugees by boat, and they are overwhelmed, so they have basically in Naples a center where they feed, educate, teach them French and Italian, and teach them how to basically function in society. So it's really great that Italy is taking them on, but it does kind of affect their socioeconomic status and climate, and how the citizens themselves actually feel about it. Relating that back to healthcare, I did see many of the refugees in the free clinic, which I was at, which was a really great experience. But poverty does affect healthcare because those that are poor, while they do receive healthcare, which is great, the standard in private healthcare, which you have to pay for, is much, much higher. So it's difficult because if you have receiving the free public healthcare, you may have to wait for hours or not even get in, or there's lack of resources, there's not enough medication, there's not enough doctors. So it is a really difficult situation that they are trying to address in Italy now, but it's just kind of compiling, and with the refugees and more people and more tourists, everything, it's really taking a toll on their public healthcare system. It is required in Italy that if you are employed, your employer must offer healthcare, and there are many free or low-cost clinics available, but like I said, there are so many problems that come with those as well. So moving on to where I actually volunteered, it was through the Fondazione Massimo Leone, through IVHQ, and they're a nonprofit organization that has been working in Italy since '94. They function out of a church, and it was the best experience to be able to go and meet the people that volunteer their time there, and they actually not only will help in the clinics for the homeless, but they do everything that they can. They'll take in refugees, teach them how to make pizza and get them employed at jobs, or they'll make pottery that they can sell and donate all of the funds to the homeless. They're really involved, and it's great to see how many lives they can touch and affect. So this just highlights all the different type of specialties that the clinic offers, and the clinic is packed. The moment the doors open, there's a line of people waiting outside. A majority of them go to get dentistry done because dentists and dental work is valued in Italy, because as far as getting a job and employment, teeth are important and the appearance of teeth, and so it's kind of giving people a new start. I saw a lot of teeth extractions. I was able to help with, supplies and helping the dentists with different procedures, which was a great experience. I also was able to help the cardiologist do EKGs, the dermatologist look at different skin conditions such as scabies or other kind of really interesting cases, and it was beautiful because all of the doctors volunteer their time. They'll go to their own hospital, work their full shift, and then go directly to the clinic after a night shift or after whatever schedule they're working, and they are very, very caring, and it shows, and I felt very lucky to be there. Martina is the woman that runs the clinic, and she was fantastic. She didn't speak much English, but she was so expressive and had such a great personality that I was able to understand her and everything that she needed, and it was great getting to know her. I volunteered at the clinic 5 days a week for 5 hours. The most valuable thing that I was able to take from the clinic was just to kind of get out of the mindset of the United States and how everything is so just like the rat race, and make all the money you can and don't take breaks, and in Italy it's a very different pace, and it's more focused on being happy and doing what makes you happy, doing what keeps you healthy, and so that had a big impact on me and just how I view life. Another thing that most impactful experience that I had was at the clinic, and a refugee was coming in for his first dental work ever. He'd never been to the dentist before, and he came in and he was really nervous. He was crying and shaking because he didn't understand what the tools were for, so I was able to just hold his hand and calm him down, and he understood a little bit of English, so kind of just, holding his hand and being there for him, it did help, and I think that it showed how important emotional connection is with patients and making them feel comfortable. And it also just reiterates how grateful we need to be in the United States for the basic things that we have every day. And taking that kind of view on being grateful for what you have, I think that's why a global perspective is important, because it's easy to get stuck and not realize what others are dealing with in the world. And so I think, especially relating to healthcare, the fact that we're able to compare, is this successful or is it not successful? And I think that it creates standards that will hopefully improve each country so that healthcare can be more available and better for everybody. But I think that it's important to take into account the global perspective of what everybody else in the world is dealing with, and not be so single focused on what's only going on in the United States, because it improves standards all across the world. So lastly, just the impact that this did have on me. I really do understand the Italian healthcare system better. I have an increased appreciation for the level of care that we do have in the United States. It is standardized, and it's focused on aseptic techniques and clean and infection prevention, and that may not be as accessible in Italy or other parts of the world. And I was able to see the differences in values of just, like I said, taking your time, or even the importance of family and meals and religion in Italy. Every single street there's a church, and not that you have to be a certain religion, but just I think that it is a great thing that Italians do value, those messages of living your life the best that you can and being the best person that you can be, and incorporating that into their everyday life all the time, I think is really powerful. Lastly, as a nurse, I graduate in December. I think I will definitely take into account how Italians focus on that emotional connection, and it's not just let's get them in and get them out. It's really about talking and laughing and experiencing the moment and making the best of the moment, no matter how bad it is. And it's not as money focused or status focused as it is in the United States. So that's something that I will take with me. And to finish here, some pictures from the trip. I had an absolutely incredible time. The food, the people, the clinic, it was an amazing experience. I'm so happy that I had the opportunity to go. I would absolutely hope that I can go back to Italy one day, and I hope you enjoyed this presentation. Thank you.